It's a serious problem. There's about 30 million undiagnosed patients in the United States. It can lead to diabetes, high blood pressure, obesity plays a role in that. And so a lot of people suffer from this condition at nighttime. They don't know it's happening, and it can affect your life and shorten your lifespan, so it's a serious deal.
I struggled with losing weight and being healthy. I was in a pre-diabetic state and had high blood pressure and was on the verge of taking blood pressure medications. When I learned that treating sleep apnea can reduce those symptoms. And so in my personal journey with sleep apnea, I've lost over 80 pounds. I'm no longer pre-diabetic or even close to that. Last A1C was 2.9 for me. And I don't have high blood pressure, not even coming close to taking high blood pressure medication. So for me to not be committed to that long-term medication list was huge, and to be healthier and sleeping better. For me, when I corrected my sleep apnea, it was a profound change.
Potentially life-threatening for people. It was really eye-opening to hear as well how many people have undiagnosed sleep-disordered breathing and how common it is. I was tested for it, and I have a mild form of it, and I was completely unaware. It starts with an initial telehealth appointment with one of the sleep doctors that we're partnered with. From there, they determine if you'd benefit from a home sleep test. If that's the case, they mail you a device to wear at home, typically for 2 nights. You mail it back, they go over the results with you, and then if you're diagnosed with any sort of sleep-disordered breathing where you'd benefit from an oral appliance, that's where we come into play. You come back to see us and we fabricate that appliance for you.
I think it's important, especially as a dentist, where we see signs of this first before we can screen patients and see, grinding of the teeth. We can see acid reflux erosion on the teeth and things that are damaging the teeth. And all these things play a role in sleep apnea. It's part of the puzzle for a lot of patients. And so if we can prevent these problems and help people treat it down the road and lengthen their lifespan, sleep better, be more alert, just have a better quality of life, that's something that we're really excited to be able to help with. We're going to be able to screen patients. We're going to see these early signs. We're going to be able to point them in the right direction and get them through our protocols that we have in place. Get them diagnosed and say, hey, we have a problem here. We have sleep apnea. You have some sleep disordered breathing. You're a snorer. We can fix it. Here's how we do it. And we're going to be opening your jaw mechanically a different way. So we have a pharyngometer and a rhinometer, 2 machines. The rhinometer is going to measure your nasal passages and your nasal airway. The pharyngometer is from the nasal passages down to your lungs. It essentially measures the volume of the airway, and we can simulate a collapse by doing certain techniques. And we can measure the volume of the airway, the lower end of the spectrum as far as how much your airway collapses. And then we have certain jigs and positioning devices to where we can get you to a point where we optimize that airway and have the most airflow, and that's where we can position your device, and so it keeps you open all night long and allows more oxygen to get to your organs and your brain and all these important things that you're missing out on when you have sleep apnea.
It surprised me once they did the breathing test, but I wasn't surprised how I felt as they were going over the symptoms of the fatigue and how it affects the brain. And
I meet with all of our patients to discuss the referral process, how that works. We go through it step by step, and I'm here to answer any questions that they may have about insurance coverage, the process itself, how long it takes, and we're partnered with a sleep lab that helps us with assisting our patients too.
The oral appliance therapy patients will wear their appliance on average of 7 hours a night versus 4.5 for a CPAP. So it's easier to wear, it's less cumbersome, it's going to be more comfortable. And then the efficacy is encouraging as well. 89% of patients see a reduction of at least 10 in their AHI score, which their AHI score is the average amount of times that they have difficulty breathing or stop breathing every night. So a reduction of 10 on that scale is tremendous, and that's really encouraging, and that's come from studies in the last 10 years.
For a lot of people I've found in communicating this with are like, my husband snores or my wife snores, and the amount of people that I've come across that even sleep in different bedrooms as a result of this was like mind-blowing to me. I didn't even know, right? And so learning this and knowing that something like this can get people back together and relationships healthy, and mine is thriving. It's a game changer for sure.
being able to screen these patients and really make a difference in their lives in a different way than just, fixing their teeth and helping with those sorts of problems. It's something that's really cool, and I feel really privileged to be able to do it for them.
I absolutely would recommend it.